It's Shannon.
Hello, and welcome to Keeping It Real with Shannon Live.
It's Shannon.
Because you don't know how it's going to turn out.
It's Shannon. It's Shannon.
My kids empowered me to get out.
What's going on with this remote learning in the midst of COVID?
Keeping it real.
Working for different elected officials, learning and understanding how to put the community first.
Hi, and welcome to Keeping It Real with Shannon. So thank you for joining us tonight. How's everybody? Hope you share. We have a wonderful guest coming on. I've been feeling kind of depressed myself with everything going on in this world now. It just makes you depressed. I'm not a depressed person, but sometimes it just makes you depressed. And hopefully we can get some of insight from our special guest tonight to kind of get us back on track again.
Absolutely, especially listening and watching the news all day. That's not a good thing. That's not therapy. For those who think what's on the news is news, it's not therapy.
But we're going to need therapy now. So you can introduce our guest for us?
Absolutely. Our special guest tonight is Reverend Tamara R. Jackson. She's an author, motivational speaker, filmmaker, and founder of Hopeful and Consultant LLC. Let's welcome Ms. Jackson to the show.
Well, hello there, Ms. Jackson.
Hello, thank you for having me.
Well, thank you for joining us. I'm so happy you're on tonight. I was saying been feeling a little depressed with all of this news and everything happening, and you know,
it's hard not to.
Exactly. And the thing about it is, every time something happens, you know, they want to say that people have mental illness. So, I mean, I'm trying to get the understanding.
Well, they like to say certain people have mental illness.
Well, certain people have mental illness. So
certain people. Certain
exactly.
People.
So
that label is even a privilege, okay? So certain people get that label, that consideration. Yes.
So let's just start off with you. We want to talk about, there's a lot of under mental health to talk about, but there was one we were talking with you about called environmental trauma. Could you just start us off with telling us what is environmental trauma?
Sure. So basically, environmental trauma is kind of the emotional, physical, psychological response we have to certain events, communal events, adverse events that are like wider than our like immediate selves, right? Is our response. And usually these effects, what happened with us, they have these long-lasting effects, on our ability to function, basically. So, like an example for, a light, quote unquote, example would be kind of like when they released the pictures and stuff of the footage when Kobe Bryant and his, and all of that whole accident that killed, just a number of people, and just people kept on playing, I think it was a video release. And I was like, you really need not really look at that, because you're not going to be all right. Fact is, it's hard to see somebody die. I don't care where you are. It is hard to see somebody die and be okay with it.
Right.
You're not going to be all right.
That's true. And every traumatic event that goes on in the news, it's worldwide, anything is national. They put on the news, they constantly keep it going.
Yep, it's trauma porn. They loop it in and loop it in, loop it for ratings. Yeah.
And that's coupled with everyday events that people go through. I mean, look at the capacity I worked in. I've been around death every day. Working at the ME's office when I investigated my homicides, DOAs, and looked at death every day and worked on the pediatric death registry. In some cases, still stay with you. Certain instances,
Absolutely.
So you try to have some type of normalcy. And people really don't know what that means. But sometimes, even today, although retired, I'm still actively involved. Going on call 3 times a year for operations for any traumatic event in the city. So what that is, it brings us to the place where we go there and just let other officers know about self-care. They have a normal reaction to an abnormal event. And they understand and differentiate that. And they don't understand. We see a lot of things in that capacity. We see a lot of things that common person do not see every day. So
So
that's why also, I'm sorry. To your point, Vanessa, that's why also you have a lot of cops They have PTSD. They don't know why they're responding the way they are, when they're just on a regular beat, right? Because they're traumatized, and usually it takes, unfortunately, this big event within their personal space for the help to be offered, or them to feel okay, loosely stated, to get help for these, the traumatic event and stuff.
Well, so that's a problem. That's a problem too, because
Absolutely.
that's a problem, because you don this uniform and you're like, oh, everybody's calling you for help. Of course, cops can't have help. I don't need help. They solving everybody else's problem.
Exactly.
So that's another problem. That
I'm the hero, right?
Right.
The hero don't need help.
That's nothing that stops them from getting the help that's readily available and needed.
Absolutely, totally agree.
So let's talk about what's going on now with the killings, because we just can't get away from that with all these killings and massacres and stuff. And like now it's the young people, because when I think about an 18-year-old having even those thoughts of wanting to go to kill someone, I don't care what color they are, just the idea of you wanting to go kill someone, and even the older ones that have done the killing, with the one that killed the doctor because of his back, and all of this kind of stuff, but it's like something is going on, something is not right, because this is just like getting worse with people with these thoughts and things that they would want to go to hurt somebody.
Well, I mean, and to add to that, it's not always so much that they necessarily homicidal. They are homicidal and suicidal. So where's the recourse even to interject if there is help that if someone can help? So how do you really interject? Or are there outlets that people are going to, or they're not going to? Or what type of resources are available that's not available? What are the signs that people are seeing out there? Everybody should be a mandated reporter. When they see something, say something.
I totally agree. To add on to that, some of the things, like, just to differentiate a little bit, right? So when we think about the Buffalo shooting, right, and that was one of the persons that was given the luxury of saying, oh, mental illness, right? Which I don't believe. I think it's heart illness, right? There's something that has happened in our country, and it's not new. Racism is not new. Prejudice is not new. But there is a permission that has this turnabout that has happened, where people are emboldened and have been emboldened for the last 3 or so years, right? And not in just my words, right? My permission to be nasty to people, but permission to act on it, right? So it's okay, because I'm angry at your position, that I get in my car and I mow down a group of protesters, right? The language that we use, the difference in language that is used between patriots and protesters, right? People who are anti-American, right? So that fuels kind of how people ingest, right? What they can do, for one, right? And the situation that you brought up, Lottie, about the man with the back situation, is that I've seen and I've worked with people who live and are troubled by chronic pain, right? And usually the only recourse is opiates, right? Which is a whole nother issue that it opens, right? And I've seen in working in an integrated care environment, I've seen doctors be careless in the way they dismiss people's pain and stuff. And I don't know if that's what happened, but the one little bit of his soundbite that we get is that he was angry and blamed that doctor. I'm not saying the doctor deserved to die. What I am saying is that wasn't mental illness. That was probably frustration. That was probably feeling dismissed. It definitely was pain, and probably a level of pain that very few of us, at least on this panel, know about.
And that
no, trust me, we know about. Well, I don't know about you. I know about chronic.
No, I'm just.
No, but then sometimes, but sometimes that just could have been an outlet like the icing on the cake of something else that was going on, and he just used that as a segue, as an excuse to let off his, his whatever situation was going on. And
but it's almost like becoming a copycat. You just, whatever. Now
I don't
you're
think that was a
copycat.
copycat, though.
No, I don't think
that was a copycat. I think these mass shootings, that's copycat, right? Because you just had them intervene. Where was that? In California, right? Where the student was trying to elicit other students to do this mass shooting.
Right.
So he wasn't even gonna. No, those are copycats. And
they
I
had
think
one
that is
today in Texas.
Had
one again today in Dallas, Texas.
Yeah, those are copycats. Those are copycats. Why? Because they know that lawmakers are not going to do a darn thing about it. They're just going to, my thoughts and prayers. And for families who have had people massacred, thoughts and prayers, you can keep your thoughts and prayers. No disrespect. That is not going to bring my loved one back. Right. And and we saw, I spoke about the last 3 years or so under the former president, kind of this thing that unearthed. But we kind of saw this, what was it, 20 years ago with Sandy Hook, when there was no real recourse for what happened at Sandy Hook. There has been countless copycats because these not gonna happen. Exactly.
Right, but I'm just like, really, every time something happened, they want to say everybody's mentally ill.
Not everybody, Lottie. I don't mean to keep correcting you, but not everybody.
But I'm just saying, like, I'm just
not everybody. No, I'm gonna keep it. What do you say? Keeping it real with Shannon. We're gonna keep it real. No, not everybody.
That's what I'm saying. I'm tired of
you brown, no, you do not get the luxury of having a mental health evaluation. You are not gonna come out of that situation 9.5 or 9.8% of the time. You're not coming out of it alive. You're not gonna get stopped at Burger King or perp walked like the guy at Tops. You're not. You're just not.
So question
in a body bag.
Question to you, because this is your area and you do talk to people and diagnose people and stuff like that. Because now, since we talk so much about mental illness all the time, like when you're talking to someone and I guess you're diagnosing them to see if they have mental illness, then how do you distinguish if they do have mental illness? Because I mean, like, I remember a long time ago, one of my family members had mental illness, right? But they never did anything like hurting anyone or anything like that. Most of the time, if anything, they would be hurting themselves or something like that. It's not like it is now when they talk about mental illness. So sometimes it's like, to me, confusing, like, okay, what is considered mental illness?
Well, firstly, I'm going to say a mental health crisis, right, or a challenge, right? It's not one-stop shop, right? It's very, while there are some things that you can definitely identify that are universal for diagnosis purposes, kind of how a person operates in that struggle is really that person. So how we diagnose.
So can we hold that thought 1 second, Ms. Jackson? We're gonna hold that thought. We're gonna take a break and come right back. Okay. All right. We'll be right back.
It's Shannon. It's Shannon.
I don't remember how it started.
Go to that.
Our back and forth. It always came back. Dad! You probably don't remember what you told me.
That was perfect.
But I heard every word.
Hi, we're back. If you're just joining us, our special guest is Ms. Tamarin Jackson, and we're talking about mental illness. And before we went to break, I had asked you the question about what
Sure.
really is
So,
mental
as a
illness.
clinician, how we kind of deal with mental illness are, I got to be particular about something. So, when somebody comes to me, we are interested in if your symptoms have lasted 2 weeks or more. So, usually the inventories for depression, there's different inventories that you give an individual trying to see kind of where they are on a scale as far as like depression and anxiety, right? Have you had these symptoms or these disturbances in your functioning, like I spoke of earlier, for 2 weeks or more? And that's really the litmus test. Now, when it comes down to PTSD, it can be like with those symptoms can arrive within a month or so to the exposure of the event. That's usually kind of how that is calculated. Now, like I said, all mental health is not the same. So that's just, I just talked about PTSD, depression, and anxiety. Then we get things to people where there's mood disorders, right? So you got bipolar, schizoaffective, all of those things would be kind of like under mood disorders. And so those are calculated. I mean, all of it, you're supposed to get an in-depth psychological evaluation. And I wouldn't do that. That's actually done by a psychiatrist or a psychiatric nurse practitioner. They do those evaluations and stuff because they're also the ones who diagnose. But after a person is diagnosed, if it's that, on that level and stuff, and if they need meds or they even accept that they need meds and stuff, then yes, it should be coupled with therapy. So then you have a person like me that is LCSW, you have licensed professional counselors, you have psychologists, whatever. But the role, you notice I didn't say psychiatrist. Their role is much different in this mental health sphere.
So do you think that this is something that just develops in the person, or do you think it could be
both
something
and.
like it's born? Huh?
It's both and. Some people, just like how we have hormonal imbalances and such, some people are born, right? And there's a family history. That's one thing that we all do. No matter which type of practitioner you come, we're going to take a family history of mental illness in your family. Who has what side, how close it is, this, that, and the third, right? Yeah. But so some you are born with, and it doesn't mean that is going to exactly affect you, but usually it just takes an event, an adverse event, not saying the first one or whatever, but it just takes an adverse event to kind of like unlock what's already in your DNA. Okay.
Because I was thinking about bipolar people.
Huh?
People that's bipolar. I was, I often think about
that's usually hereditary.
That's what I was getting ready to say, because I was thinking like, how do you just develop to become bipolar?
However, it usually is hereditary, but it's not always hereditary. Something can happen. Go ahead now.
So they just lie dormant sometimes, just like
exactly.
Like
and sometimes
no, but that's my point is, how did that just come on to the person to be bipolar?
Because an adverse event has happened. Right. So I'm gonna give you an example. I'll give you an example of where somebody can develop mental illness who didn't normally have mental illness. A child is born, right? And they are abused, constantly abused, right? It is not, that person can, they call it something else now, but they can develop splitting, right? This splitting, right? So then we used to call it multiple personality disorder. It's called something else now, right? These personalities to speak, to protect them, or all these other things, right? So the person wasn't born necessarily, but there's this adverse event that has happened that caused this. The same thing, even so much, I won't go with a specific mental diagnosis, but dissociation, right? Something can happen to you, right? Like someone can be violated, right? You hear all the time. You hear, it's not uncommon to hear what a person who has been violated. And I'm talking about sexual violation here. I'm just trying to be careful because I don't want to trigger anybody that's listening, or whatever, where you, as a therapist, I hear things like, oh, I gave up on myself. You didn't give up yourself. You submitted, right? We hear these things: fight, flight, submit, and freeze, right? These are these biological responses to trauma, right? So the person wasn't born with it, but there is this event that has happened that has caused this emotional, psychological, and physiological response.
Oh, okay.
And that's trauma.
And sometimes people don't know to differentiate it from something that's pre-existing or something that has developed over time.
Absolutely.
So you have these other things in the environment that are triggers. They don't know that they're triggers because they have not been predisposed of even having a reaction to it.
Absolutely. Like, I give an example of what Vanessa just said. When the documentary came out, Surviving R. Kelly. And again, I was still working in public health at that time. I had several clients who had, been violated, had, that in their, not that scenario, but, and they were watching it and they were triggered. And that's what I mean. That's what I mean, kind of like in that environmental kind of feel. It's not happening in that moment to you particularly, but your exposure to it is causing this response, trigger in some case, in the case that I just gave an example of, tapping into something that you did deal with personally. You're not going to be all right. Stop looking at all these videos.
Yeah. Because I know with the bipolar, that was when I was working in, I work with parents a lot. And so we did a program one night, and the publicist, oh my God, I can't think of her name right now. She's the publicist of Chris Rock and all of them. She's out of Manhattan. Her name would come to me afterward, but she came to the district to speak to the parents, and she got up and started talking, and then she started talking about, she was bipolar, all of this, and she had some issues and stuff like that. So she came out with it and started talking. So after she started sharing, then the audience started to share it, right? And then, like, one of my parents that I work with, she said, yeah, because I'm bipolar myself, and I like turned around and looked at her like, you bipolar? I mean, I didn't know it really, that's what it was. I just know sometimes she would go off. Like sometimes
those extreme highs and extreme lows, and that's bipolar 1. Bipolar 2 is the person that is chronically depressed. Manic depressive. And both are dangerous. When we're talking about mood disorders in particular, they're dangerous because those extreme highs, right? That impulsivity, which is part of kind of the mania, right? I can do anything. I can be. I'm invincible. That can. That can lead to lapse of judgment and dangerous behaviors, right? And then on the opposite side, the depressive side and stuff, it can be so low. A person can get so low that's when they become suicidal. I had a cousin that jumped off the Hoover Dam. She had bipolar. She jumped off.
It's another thing for people to really identify when they're having these cycles of changes, for them to really identify and seek help. That's like one first sign of defense for them to get help. Sometimes a lot of other people are in denial. They figure they're just going to wing it out. They're not going to get help. They'll be okay. And they do some other type of self-care, what they think is self-care. But it's really out there that people really should seek help if something's different, if they're feeling different, if things don't feel right. Because it's one thing to know what you can do something about and get help for it, than not to know and don't have no control over it.
I totally agree. I think I think we're starting to see a shift. One thing that has shifted within, like I said, just still 3 years or so that we've been in this pandemic, because we're still technically in this pandemic and stuff, is that African Americans and other people of color have become more receptive to therapy. Because there has been this forced narrative in our community And I said it when I was on this podcast, you know, our bodies have these responses for a reason. They are like alarms telling us that something is not right. And even if you don't have the words to say what's not right, it's best to get to a professional, emphasis on the professional, to help you explore what is going on with you. Talking to your mama and them, and they ain't deal with their issues and stuff like that, you're always going to be dissuaded from getting professional help. And seeing a therapist does not mean that, quote unquote, you're crazy. There is no crazy. People have challenges, just like somebody may have challenges, you know, with their health if they have like whatever disease or whatever the situation are. Those of us who wear glasses or whatever, you just need assistance. So there is no stigma in it, or there should be no stigma in it. And this, you know, I'm a ride or die. I can take everything. That's for the birds. I'm telling you, you'll find yourself in an early grave with that mentality. So my biggest thing is I want to dispel that myth within our community that, you know, to see a mental health professional means you're weak. No, it means you're wise. We were never, the body was not created. The body, right? Later for what skin it's in. The body was not created to withstand all this stress and, you know, all that stuff. That's absurd.
Yeah. That's a major issue you just said about them not wanting to go get counseling or help, or I mean,
take meds and everything.
It's like you know, you're messing with my womanhood or manhood. You know, I don't need that. You know, and all like that. But we're gonna have to wrap up this first part of our show. And we want to thank you, Ms. Jackson, for coming on and talking to us about this hot topic.
Thank you for having me.
Going on, and we do hope people, you know, if you're feeling depressed or you're feeling anxious or you're just not feeling yourself, there's nothing wrong with calling a therapist to get help.
That's right.
And you have someone right here that you can call if you need help. Her information.
Well, if you're in New Jersey. No, I have to say that. I have to stay within my license. But real talk, if you do need a therapist, 2 quick ways, real quick. Either look in the back of your insurance card and you call that number and you ask them for practitioners that are in your plan, or you can visit Psychology Today. You just go on the website, you put in your zip code, and practitioners in your area will come up. That's the 2 easiest ways to find help.
Okay, well, you can do that, or you can go through the tunnel. Either one you want to do, it's okay. You can still go through the tunnel. She's great, and that's definitely call her if you want to get some help. So thank you for joining us today. And as always, we'll see you next time. And if you want to stick around for our after show, stick around. We'll be back for the after show. So we'll see you next time. Take care.
Bye.
Today's show is sponsored by Abu's Bakery. If you have a sweet tooth, stop by Abu's Bakery for some delicious cakes and pies.
Do you like beautiful pictures for your home or your office? Then stop by Stage Watch Gallery. They have a large selection of pictures from around the world.
It's Shannon. It's Shannon. It's Shannon. It's Shannon. It's Shannon. Keeping it real. It's Shannon. It's Shannon. It's Shannon.
Hi, I hope you stuck around for our after show. But Miss Jackson, I wanted to ask you something as a continuation of what we were talking about. What should we do? What should we do if we know someone or we see someone that we feel that something is going on, that there could be a little something going on there, but you know, you can't come out and tell them, look, you need to go get some help or whatever, something like that. What's the best way to start talking to someone and, you know, approaching them, you know, to try to to get them to go see a therapist or, who they need to talk to. Because,
I would
people are
say,
so sensitive and touchy.
well, some people are going to always be sensitive and touchy, right? That may be part of what they're battling with in their non-diagnosis, but need of a diagnosis, right? But the best way is just to be truthful, but be truthful without being judgmental, right? Because being judgmental just feeds into the stigma, right, of what may be going on with them. And you can even support them and say, I'll go with you, or I can work with you to identify someone that you can talk to. That's really the best way, is head on. I mean, yeah. If somebody's a danger to themselves, then that's a whole nother escalation, whatever. Then that there's crisis and, involuntary committal. But if a person is not at that level, I'd say have a conversation with them directly.
Yeah, but like you said, we talked about earlier that people are more black and brown people are more receptive of getting the help. And I think because all the added attention that's outside when things do happen, they keep talking about mental health, mental health, mental health. But it's a different kind of mental health when you think about things that's not community in the community as far as the lack of resources. So now they're more receptive to going out and seeking help. They're like posted all over the place. There's people they can identify, like people that they follow on social media that's come more out. I don't want to say demons that they deal with, but the struggles that they deal with, and they can identify with individuals. So I think that's one of the contributory factors of why they are seeking help, and that's a good thing. The more that people go seek help, the more, I don't want to say the more safe we could be, not just safe for ourselves, but they can be safe within themselves as well.
Absolutely. And even to add to that real quick, what you had said earlier, the example you had given Lottie about the, I guess, promoter or publicist, the more people speak out, the more normative it becomes, right? And I think a lot of people, what has been great is that there are a lot of people who have began to normalize, right, their own diagnosis and just to promote mental health. Like you have Taraji P. Henson, who's a big advocate, or whatever. And you have others that have been very vocal about their personal struggles, are just advocating for, no, you get help. Your mental health matters. And I think as that continues to happen, more people will feel comfortable seeking help.
But mental health is just a chronic disease. If you don't take care of the problem, you deteriorate from it.
I also, exactly. One quick thing I do want to put out there too. I also want to let people know that to take care of your mental health doesn't mean that a problem has happened. Let me say that as well, because everybody that sees therapists and stuff, they don't all come to us because they have, this major crisis in their life. Some people, they're preparing for transition. They just need a sounding board as they make, critical life changes, and stuff like that. So all, the use of a mental health professional is not only for crisis, but it also is for prevention as well. I just want to put that out there.
Well, what do you think? Because I was thinking, when I think about stuff like this, I was thinking about that too. I was thinking about, I think we should have more group stuff. Like, I think even when they have these centers or whatever, just rather than going to see one-on-one person, I think if they would have a group setting, where people would be in that group talking.
They do. They actually have, organizations that only offer group therapy. Group therapy, I mean, I'll say it like this: group therapy is great if you're if you know how to be in a group, right? And if you're ready for a group, because everybody's not ready to say out loud what troubles them around strangers, right? It is much easier for them to say it to one person than 10, right? And just understand, I will say this, just understand group therapy works a lot differently than individual therapy.
What's the difference?
Well, group therapy, usually in group therapy, those are not processing groups, right? Because if everybody start opening up, there's no real way to manage what will come out, right? So those are usually skill based, right? So to help you gain tools to regulate yourself or to not be as triggered and stuff like that. So I do want to say that group therapy is usually skill based, right? Unless it is something like, and again, this is not, it's not a perfect example, but like unless it's like something like a NA or AA, which is not even professionally led, that's peer led, right? So you have to understand what the group is set to do. Now, individual therapy, it is just that, we're going to peel back your onion, right? We're going to get to the core of what your issue or issues are and build tools and, triage from there. So just know that, like, if you're going in a group and you think a group is going to, you're going to get all of that. No, there's not, it's almost impossible. Not saying you can't get some relief from a group, because there is some camaraderie, right? There is some, I'm not alone, but they function very differently.
Yeah, I just want to add something to the individual, consultation. Some people may think, oh, so what am I going to get out of sitting on somebody's couch telling my story? And put people to understand that consultant, licensed professional are trained with particular tools and strategies, and can bring people to the realization of what they don't see. We look in the mirror every day, but we don't always see ourselves the way other people see us. So what happened? They don't understand the dynamics of what their whole counseling is. So that's another thing that they don't understand. So don't want to dismiss that. For others who are out here watching the show and thinking about and have that mentality about, oh, well, they can't do nothing for me. There are things they can do for you, things that they can identify, and tools and strategies that you are not aware of. So,
absolutely. It's not just going to be you talking, regurgitating your trauma. Right. That just re-traumatizes you. And for a person like me, who is a somatic therapist, that's why I'd go to the body. We're going to heal it through the body. Why? Right. Because your body memories and the way your body responds, why you hyperventilating when you get around certain people and all this stuff, are shaking or can't, drive or whatever the situation is. That's your body's responses. I'm going to work with you to heal it through your body, not what you tell me. What you tell me is cool, but your body remembers much better than your ability to recall.
Absolutely.
Is that something you using on the body?
That is a specialization. Yes. I'm a somatic practitioner. I'm not going to say there is no talk involved, but yes, I'm trained in special modalities. Like one is called EMDR. There's sensory motor psychotherapy. There's EFT. There's a whole bunch of things, IFS. You know what I mean? So there's a whole bunch of modalities that are body based. To deal with kind of those things, those heightened sensations that are usually associated with trauma.
And I'm glad to identify those things, because people just think it's just one and one kind only. They don't know the in-depth.
Exactly, because it's not, even with those, it's not a one size fits all. And exactly. Everybody, absolutely.
What you mean when you're working with the body? It's not a.
Well, they all work differently. They all work with the body, but some are a little gentler. I'll use that word. Some are a little gentler in their approach. But but it works the memory through, or the trauma through, based on the body's response to it.
But sometimes, even with your experience, I want to add that sometimes when you deal with clients, you may be able to identify a much deeper.
Absolutely.
He's like inpatient hospitalization base. So that's
absolutely. I will tell somebody it doesn't happen often. Because I vet very well. I do my best to vet, because it's important that a person is in the proper level of care. And if everybody is not appropriate for outpatient care, whatever. Some people need an IOP, intensive outpatient. So that's like most of the day. That's 3 out of 5 days a week, whatever, or more. Some people need, residential programs for a while, and there's steps to it. So it depends on how chronically how chronic the mental illness is.
Right.
Mhm. So overall, mostly when people come in for treatment, you know, how do you? Because sometimes I wonder when when they give them all of this medicine. Sometimes to me, the medicine makes them worse than what they were before. The medicine seems like it's making them be depressed. So
Most
how
they're
is it
over
decided
medicated.
whether they get
Absolutely,
medicine
absolutely.
or
Some,
whether they just
yeah,
get therapy?
some people, and again, this is where I will tell anybody, you have to advocate. You have to
Yes.
advocate. And this is also where I will say, tell people that, there is no magic pill, right? So I'm all for medication, but I'm for medication and therapy, because the pill is still not dealing with what has you in that space, right? It's just it's kind of like the hope is to level you out where you can function as you do. But yeah, to just be dependent on the pill, that's still not addressing the issues,
But
right?
you know what? No,
So it has to, I'm a both and, person. I don't diagnose, and I don't want the pressure of I'm sorry, I don't prescribe, right? And I wouldn't want that pressure, because again, with what we have seen kind of with the opiates, and and some of these things are habit forming and stuff like that, and so you just got to be careful.
right. I just want to add.
Sure.
I just want to add to, just like when you go to doctors for any kind of new diagnosis medically, there's different classes, there's different doses, and sometimes there's trial and error of how your body reacts to them. And sometimes people take over-the-counter medication, herbs and supplements, and other illegal sedentary lifestyles they have, and they have counterindication with these medications.
Yep.
So it's all well and good when they do a therapeutic level for it and you off balance. It's hard to really get that regimen back in place when you have all these added factors and things
Totally
that
agree.
factors.
Yeah, good point. Absolutely. You can't go to a professional and then try to also triage yourself.
Exactly.
Yeah. You'll wind up killing yourself, and I don't mean that disrespectfully. I mean that very honestly.
What do you think that we should do? I mean, I know we're under a lot of stress, a lot of pressure, a lot of people are and stuff like that. But what should we be doing to not that you can stop anything, but at least it's sort of helping to prevent you falling in to, like a depression, and because sometimes I think when people be getting all depressed is because they're not active, they're not doing anything, and most of the time they're sitting by themselves, they're not communicating with people.
My encouragement is this, because part of depression is isolation, right? So I'm not going to say, oh yeah, go ahead and socialize. What I will say this in a preventive measure, and I'm not going to use the word should, because I'm not trying to bring about judgment, right? I just stay away from some words. But some tools that one can use is exercise your no. Know that no is an answer, full stop, not need of explanation, right? And no is like the first place where, like, when you're assessing your why, and this with people, places, and things, assess your why. Is this person, thing or place life-giving or life-draining, right? And from that answer, be purposeful in how you move. Now, I realize that everybody can't separate themselves from a toxic environment necessarily. And I mean this more than a relationship. I mean this in employment situations, right? Because again, I think about the pandemic, how some had to go to, this and this and that. But there are ways that you can reduce your exposure while you're there, right? Use your sick time, use your PTO, use bathroom breaks. Seriously, like if you need to take a beat, take what you need. Take what you need, because it's better that you walk away and gather yourself, go splash some water on your face and stuff, and then come back, refreshed, than going off on somebody, or going off, period, or for yourself, because sometimes people internalize things, right?
Right.
As opposed to externalize it. So, and also I would say, what are you doing for self-care? Like really, like you can't work all the time.
Right.
You can't be on all the time. You can't, I mean, even if you're working, then you're somebody's parent or you're somebody's woman or man, you know what I mean? And whether it's husband or wife or not, like, no, you have to take a beat for yourself, take take your time in that shower. Like if that's the only you time that you get, take your time in that shower, take your time in the bathroom. Seriously.
I was going to add that. Mm-hmm.
Yeah, if you exactly, if you're an early riser, get up before the rest of the house wakes up. Get your coffee, get your tea or whatever, or just be still and let your give your mind time to wake up before you have to be on for somebody. And the same thing you could do at the evening. If you're a writer, do dumps. What that means is like you open up a notebook or a journal and stuff, you can this is great for before the bed. And you just write down, no rhyme or reason, don't think about it. You just write down whatever comes to you about your day. You leave that and you close that book and you rest your head. So those are some things. Like some people like baths, but I just tell they have shower bombs as well, or shower things. You put them in the shower, they're aromatherapy. You get 15 minutes, 10 to 15 minutes of bliss. I mean, there are ways that you can. I hate to say steal because self-care, you shouldn't have to steal, but self-care is not selfish. I want to say that, you find what is yours and you do it unapologetically.
Right, that's true. Just like you, just want to add this to add to self-care. I was going to jump on that topic. Just like you call for a doctor's appointment and you put in your calendar, you need to pencil yourself in your calendar.
Yeah.
There's no phone, no contact, just you. And some people don't think self-care don't have to be something dramatic and drastic where you got to spend money. 5-10 minutes a day is better than no 5-10 minutes.
Absolutely. And also do yourself a favor, because I know my phone, I do it. Come 9 o'clock, my phone goes on do not disturb, and it doesn't come back on to 7 o'clock. Put your phone on do not disturb. Nah, seriously. Like there is no man, listen, I don't want no texts. I don't want no phone calls. Don't get me wrong. If it's a real emergency, somebody will be able to get in contact with you. But not like, but just for the everyday, that somebody ring your phone. What you doing? The hell, it's 11 o'clock. I'm sleeping. The heck you mean? What you doing? No, I'm serious. Like, nah, you don't have to be on. I'm telling you, like, create your boundary. Create
your appointment. Yourself.
Well, Ms. Jackson, we want to thank you for staying for our after show. And I tell you, you were absolutely right, because I do everything you say. I don't talk to anyone between 12:30 and 3 because I'm watching soap operas.
Okay.
And sipping on my stuff and eating chicken wings and devil eggs and stuff. So don't bother me between those hours. I just set that time because if I'm home, I was like, just like you said, you need to set some time for yourself. So
absolutely.
I said, well, since that's what I like to do, that's my time. I'm not talking to you with that time.
A lot of these right. If you call her, why are you calling me? Don't you know watch my story? I'm like,
yeah, like please, you're absolutely right. Because that's what I say. People, I think sometimes people just overwork themselves and they don't take time. They don't want to go on vacation. They don't want to spend no money to go anywhere.
Absolutely.
I mean, really, that's what you're working for, is to spend the money. Go to the spa. Now I love going to the spa. Before I used to didn't go to the spa that much, but now I realize how good the spa is when you go.
I know that's right. Spa is bomb.
At least I can walk when I come out.
Hello, and I smell good. Oh,
exactly. Yeah. So thank you for watching today, and I hope you've learned a lot and got a lot of information from Ms. Jackson. If you have someone that has mental health problems or issues or anything, that talk to them, like she said. We'll try to help them as much as we can, and encourage them to get help. And this way, hopefully, things will change, things will get better. We just have to stay in prayer. That's all I can say. We just got to stay in prayer, because too much stuff going on with people now, and it's just too much. So thank you again, Ms. Jackson, for coming
My
on,
pleasure. Thank you for
and hope
having
you
me.
will, come again and talk to us some more. We certainly enjoyed having you on. So thank you.
My pleasure.
So thank you, Dr. Vanessa. So as always, we'll see you next time.
All righty.
All right.